Hey guys, welcome back to my channel. Again, my name is Danny Nair King Elliott. Um, the one and only Nair. Those of y'all that have subscribed to me, followed, shared, y'all know me just from not even just YouTube videos, just in person, friends, fan members, Facebook, Snapchat, any social media for y'all that have known me on all these platforms that I'm on consistently. I just want to thank y'all, for following me and watching my videos and, just supporting me regardless of that, sharing a video or just watching it or, just telling me to keep posting random stuff just because y'all just want to hear or whatever the case may be, and I'm really trying to get involved in this transition lifestyle, and I just want to talk a little bit more about the procedure I had this past week and a day ago. On the 17th of February this month, I had a hysterectomy done. With that being said, most of y'all already know, these things that I have been going about doing. I don't know if that light actually helps or not. I think this helps. I'll just keep it closed. I'm over here at the lake though, y'all, talking to y'all. I just wanted to be in a, contained area, just relaxed and, just enjoy myself while I speak to y'all. I don't get to do this a lot, so I want to take my time while I'm off work to do this with y'all and, express more and spend more time doing this, even if it doesn't mean anything to y'all. But back to the hysterectomy, I just had a hysterectomy done, on the 17th. It went great, I wasn't nervous at all. The way they do things, every hospital is different. Sometimes certain facilities and certain places, they do stuff differently. So I'm not sure whoever may be watching this might have like questions that, have been asked before or is still going to ask, but I'm going to try and answer those questions before they're even asked and the questions that have already been asked. As far as the procedure, a hysterectomy is just mostly just taking all your woman parts out, anywhere from, your eggs, your woman parts that help you, have a baby as part of your eggs. That's completely gone. I thought about keeping them, just to freeze them and try to have a kid later, but unfortunately stopping the process was the only thing that I could do to proceed in that route, and I didn't want to go that route. It was a possibility of me waiting a lot more months down the line, possibly even over a year, before I can even start back doing T again. It was just a longer process, and I didn't want to take that route. I really, thought about it for some time, and I really still to this day, want to try to have a kid. But if it's not in, the working and it's not in the right time frame, it's not really something that I'm willing to go past out of my route just to do. I'm more focused on getting my bottom surgery done and do what I need to do with that, because it consists of more, problems. As far as complications, there's more of a chance of it than there is for like a hysterectomy. Like you might have, a peeing problem, but even if that, you shouldn't really, like, that's like 1 out of 99.9% pretty much to have a complication during a hysterectomy. I've never seen any common complications as far as review search that I've done in the past, and recently I just haven't seen anything. I could be wrong, but just on my end, from what I've seen, I haven't seen any complications with a hysterectomy. I will say that, it feels like you're cramping when you get there. Like I said, I don't know how y'all's facility does. Not every facility does the same, but I came in, I had to check in at the front desk, and I waited in the waiting room for about, I want to say, maybe 20 minutes. Maybe not even that. I waited in the waiting room for about 15-20 minutes. They brought me back. They wanted me to use this wet wipe stuff that had, I don't know what it was. Like, it was just this chemical stuff that they wanted me to strip naked pretty much and wipe myself with these wipes that has chemicals on it before they start, doing a procedure. I guess this is just protocols that they go by. They say it helps with, not, because I asked, I'm like, why do I need to do that? And she was like, well, it helps with, like, there's bacteria that we can't see, and this type of stuff that's in this wipe fights it, and it helps to make sure that, your cuts and your bruises before, and after that, we're not missing any bacteria so that you don't get an infection. It helps us a lot more when we do surgeries. So this is just protocol. So I wipe, myself from head to toe, like neck down with this wipe stuff. Let me remind you, it was very sticky. It didn't smell good. It took forever to dry. I had to air dry. There was no heat in there. It was not fun. I'm just gonna say that it was not fun. I have done several procedures before, but wiping myself with that I never have, so that was new to me. It went great. I really want to say it went great, but I did have to wait about an hour and a half just to go back, and that was kind of draining. It was just boring, I guess, because I had to watch TV. I mean, they had someone in there before me, so, they had to do theirs, and they had to make sure that they were okay and that, everything was good to go and that my room was available. So, I have, a couple family members that came. Some of them had to go to school, so some of them couldn't stay. They just came while I was there to check in, and then after that, they weren't there for, recovery. My mom did come, and she was there. My sister was there. And, everyone was supporting me, When I woke up, actually, I'll tell y'all, whenever I got back to the surgery room, they wheeled me into the surgery room. And I saw another bed, and I just started looking around. These big machines. Now, let me remind you, I'm getting a robotic. It's called the robotic hysterectomy, the new technology. Like, as far as the hysterectomy surgeries that they do now, they're coming out with this new machine. It's like a robot machine that helps them with the surgery, I guess. I'm not really sure what it does. But she said it's a new technology, and, it was new, and this was her, the surgeon that I went through, this was her first time doing it. Not doing the hysterectomy, but doing it with the robotics. So I was kind of, I don't know, it kind of like went across my mind, but I didn't really care. Like, I was just like, okay, like, she's a surgeon, she know what she's doing, And on top of that, like, she was my sister's doctor when she had her kid, because she does that too. She does deliveries and stuff. So I didn't think nothing of it, and I mean, as y'all can tell, I look just fine. I'm doing just fine. But anyways, I look back there and I'm seeing all these machines, and all I'm thinking is, man, like, these machines are so big for such a small incision. I didn't realize that until after I had woke up, obviously, but now that I'm thinking about it, I'm like, dang, like, I was in there and it was just big machines for small incisions on me, like, small. I thought there was going to be 3 because she said there was 3, but then there ended up being 4. Which I'll show y'all. I have an incision right here, which y'all can see. Then I have one right here, which is on my belly button. Then I have one right here. And then I have one right here again. Like I said, they're doing a lot better now. They don't hurt. You know, they did hurt in the beginning a lot. I want to say that I was back there. I don't even know how long the procedure took. She said about an hour, maybe 45 minutes at the least. So I want to say I was back there for no longer than an hour. But when I got back there, she didn't even tell me that she's about to give me the anesthesia, like the nausea stuff that they put you to sleep, the anesthesia. All I know is that she put this mask on me. I was laying down, and she was kind of staring at me while she was putting these like EKG stickers on me. And I just kind of like looked over her like, okay. And she was like, I am so sorry. You are so handsome. And I could not like help but like just stare at you. But I really want to apologize. I don't want you feeling awkward while laying on the table before we put you to sleep. Like, then you're going to feel some type of way. And I was like, no, it's okay. I just thought something was wrong and maybe you didn't want to say something, so you were staring at me. She was like, no, you are just very handsome. I've never seen someone as handsome as you lay on my table. She was like, I was just starstruck at some point. She's like, I'm sorry if I'm like flirting, but like you are just so handsome. She was like, I couldn't even tell, but knowing what you're getting done, she was like, that's the only way I would be able to tell. But oh my God, you are just gorgeous, and your mother and father made such an amazing, beautiful child. Like, she was just going on, you know, and I was just like, thank you, you know, I appreciate that. Like, I thought something was wrong. Like, she was staring at me, and I just kind of looked over her like, okay, is something wrong? You gonna say something? Like, something wrong with my heartbeat? Like, what's wrong? Like, I didn't know what was wrong because they was just attaching everything. They was doing my IVs. They was sticking me. They was, like, there was literally 3 people in that room, and everybody was doing something. So it's like I'm looking around, I'm trying to keep up, and she's the only one just staring at me. And I'm like, okay, maybe she's just trying to distract me. So it was just all these things that had me like thinking, okay, something wrong just because of what was going on and how she was like, I don't know, reacting, or I don't know. I just thought so, but I thought wrong. Anyways, you know, so she puts this mask on me, and, you know, she says, just breathe in deep. So, you know, she was like, breathe in and breathe out. I'm like, okay. I started getting woozy. Everything started, like, I felt my eyes getting heavy, you know, and I was falling asleep. And I was like, okay, it's about to happen. Next thing I know, like, I'm waking up in a recovery room. So, and I'm waking up, and I see my mom in there. And I'm, like, waking up like that because I'm trying to, like, open my eyes. But my eyes are so heavy, like, I can barely keep them open. It's, like, a slight second and they're back closed. So I couldn't really wake up. I'm bad at waking up after anesthesia. Like, I'm bad with waking up. It takes me some time to wake up. It took me time for my top surgery, you know, to wake up, like, after, you know, being pumped with anesthesia. Like, it's hard for a lot of people too, but me is more harder than normal, I guess. It takes me longer, I don't know. But anyways, you know, I woke up and, you know, I feel like my stomach just feels weird. And weird in a way where, like, I'm in pain, but I can't feel it. But I woke up and I felt like I was fat. You know what I'm saying? Like, and mind you, I'm not fat at all. But I felt so fat. And I believe the reason why I felt like that was because, one, I knew for a fact that I hadn't ate 48 hours before the surgery. So I already knew that my stomach was completely empty before I even had surgery. So getting out of surgery, they was giving me fluids. I was drinking a shit ton of water when I woke up. I apologize. But I drank a ton of water when I first woke up. My mouth was dry. My stomach felt very weird. I felt very bloated. And, like, I don't know, like I said, I felt very fat. Like, I was fat. Like, and I'm nowhere near obese, but I felt as if, like, I was just fat. And, like, I'm trying to, like, look down and I'm like, okay, I'm not fat, but what is it? You know, and, like, the nurse comes in and she's like, hi, how are you feeling? And I'm, like, still off and on. But I was talking really low. Like, she's like, I can barely hear you. She's like, I know that's common with most, patients. We had to stick a tube down your throat so you can breathe, so you can't really talk right now. I'm like, you had a tube? Like, and I'm pointing, like, down my throat. And she's like, yeah, you had a tube down your throat or you wouldn't be here. I'm like, okay. I'm like, something happened? She's like, we have to do that for anesthesia because, it helps you breathe. So it's pumping air into, your lungs, which eventually gets into your stomach. And the procedure that we did for hysterectomies is in your stomach. So there's a lot of air and gas in there. I'm like, okay, so pretty much I'm a like y'all blew up my stomach like a balloon. And I didn't say that, but that's what I'm thinking. I'm like, I feel really, really, like, bloated. And she was like, yeah. She was like, can you try to pee for me? I'm like, I woke up and I was in pain because I had a catheter in. And I was just moving. Like, I was trying to wake up, but I was also moving. And she was like, don't move. She was like, you have a catheter in. I was like, it hurts. I remember saying that. It hurts. And she was like, I'm going to give you some medication. Okay? I'm going to give you some, what'd she say? I'm going to give you some, I don't remember what she said. But she gave me some pain meds. And she told me that, just give it some time to kick in. And you'll feel better. But I need you to pee. That's all she kept saying was, I need you to pee. I'm like, I don't feel me peeing. I'm trying to pee right now. I was like, I don't feel myself peeing. She's like, are you peeing? And I was like, yes. But, because I kept telling her, like, I need to go to the bathroom. Like, you know what I'm saying? Like, I'm trying to tell her that I want to go to the bathroom. She's like, you have a catheter in. I need you to go pee. So I'm like, okay, you're wanting me to pee in the catheter to make sure that, I don't know if she's trying to make sure that it's working or whatever. Like I said, like, I'm in and out. I'm not really understanding what's going on just yet. I just woke up. And, she leaves it in. She leaves after she gives me the pain meds. She comes back. I woke up, I had a little bit more of a wake to me. So at that point, I was like, okay, she wakes me up and she's like, hey, well, I woke up whenever she came in the room. And she's like, I'm gonna take you to the bathroom. And I want you to pee there, but I'm going to take the catheter out first. I'm like, okay. Because I told her, like, it hurts. When she first came in, I said, it hurts. And she said, yeah, your catheter's in. It doesn't feel good, does it? And I said, no. And she said, I said, can I go to the bathroom? And she said, yeah, I have to take your catheter out. But she was like, I'll take it out in 30 minutes or 40 minutes or something. So she leaves and then she comes back in at that time. Hands me some crackers and some water. And I think that's all she brought me was crackers and water. And at that point, when she came in, my mom was asking her, because I told my mom, and I was like, it hurts. It hurts really bad. And she had told the nurse when she came in, like, hey, he said the catheter hurts. Can you take it out? And she said, well, I can't take it out for, she said, what time has it been? I can't take it out until 40 minutes or something like that. And she was like, oh, I can take it out now. It's 10 minutes past, so I'll take it out now. So she starts prepping me and telling me that, like, She's getting ready to take the catheter out. And then she says, okay, I'm getting ready to pull it out. I need you to breathe. I said, okay. So she says, breathe in. I breathe in, she pulls it out. That feeling, oh my God, like, I couldn't even tell you what that feeling was like at all. Like, I'm gonna try my best to, but you know, I had a moment. I started crying at that point. And my mom's like, why are you crying? She's like, I know it hurts. It's gonna be okay. And I'm like, no, that's not why I'm crying. She said, why are you crying? She said it like, I don't know, so many times before I answered. When I finally answered her, I told her, I said it hurts. It feels like it did. And she said, what are you talking about? And I said, I hurt like a long time ago. And I don't think that I can grasp, like, at that moment, like, what I was trying to tell her, but I was trying to. It felt like a past place that I didn't want to go back to, and all I could do was cry because the pain that I endured that moment brought back a piece of my past that I never wanted back. And feeling that, I just got emotional immediately, and all I could do was break down. I tried my best, I tried my best to tell what was going on with me. But besides that, everything else went good, and everything went well. I was peeing blood for the first time. First couple times I went to the bathroom. They say that's normal. They just pulled your women insides out. Of course, come on now, you got stitches internal and external, so you're gonna have bleeding and stuff. You know what I'm saying? They took a lot of your women parts, and a lot of your women parts are down there. So, there was just a lot of cramping in that area for the first couple days. Now, literally the day before yesterday, I was up moving around just fine. I want to say the second day, like, that's when I was like the second day I actually woke up, the day after surgery, I was in pain. All I wanted to do was sleep. The medications I did not like taking. I'd never liked taking it. But I did take it. I took the pain medications for the first 2 to 3 days after I got out of after the surgery day. The 4th day I stopped taking them. The 5th day I stopped taking them. The 6th day I stopped taking them. I have not took them since then. I do not like those feeling of I do not like the feeling of pain pills. Like, I just don't like the feeling. I never have, so I've always had an issue with taking pain pills just because I don't like taking pills. Like I said, overall, I had a really good procedure. I had a really good, recovery. I'm still recovering. I'm recovering for 6 weeks. Obviously, I'm in the car right now. I'm not supposed to be driving for 2 weeks, but I feel comfortable enough to drive now, and I'm being fully aware. I'm not driving too fast. If anything, like, I'm speed limit or under. I'm still, abiding by, what I need to do as far as recovery. But if y'all feel safe to, do these things and, then go ahead, more power to you. There's nothing wrong with pushing yourself to, recover. I'm not going to push myself too fast and too far where I feel like, okay, like, I don't want to hurt myself, because there's stuff internally that they did that I can't heal outside, that I can heal on my own at my outside. Like, I can heal with bandages on the outside. I can heal with, medicine and stuff to put on it that I can help it heal. But internally, that's different. So I'm still healing inside wise. I still have pain every now and then. Like, I have pain in the area when I like press on it, so I don't press on my stomach like that. I also don't wear tight shirts and stuff. Like, this shirt is very loose, so it's not tight at all. If I were wearing a tight shirt, or if I was wearing, like, not even tight pants, because my pants are never really like that tight on me. I just don't wear tight pants like that. But overall, I want y'all to know how my surgery did for hysterectomy. It went great. It was fast. I thought I was going to be in bed a lot longer than I am now. And yet I'm out of bed within, I was out of bed yesterday, and it was the week of. The day before that, I was like moving around like a lot more than normal. So I'm doing really good at this pace, and I feel really good about the procedure I just had. I feel like she did great. I feel like, there's nothing wrong. Everything's going good, and I just want y'all to know how I'm doing. And I'm really happy that I took this step to get further to the point of getting my bottom done. Now, as far as, bottom surgery, that's for another, that's going to be for a whole nother video. But, I have pictures and videos and stuff. There are certain things that I have to edit and clip and drag and do a lot of stuff. I do have an individual video of, I want to say the day, not the day after surgery, but the next day after the day of surgery. So I have the second day of recovery recorded. I have the third day. So the surgery day, but the day after surgery, but then that next day I recorded myself getting up, and the morning routine, and getting dressed, and just morning stuff, how I'm feeling and how yesterday went for me. That's in a whole nother video. These videos on here, it's easy for me to pick up the phone and just talk to y'all. This is easy stuff that I'm just gonna start doing until everything else is good. Like, I'm more of a specific person that likes stuff done specifically a certain way. So these videos, I want them to look as good as other videos, and I know that I can't make them look perfect off bat, but I want to try. So I know this is a little bit of a long video. I kind of talked, y'all's head off today, so that's enough for now. I just really hope that, y'all understand what I'm saying about the procedure. I hope that, I answer some questions that some of y'all may have, and I hope that y'all have, a good day, enjoy yourselves. And every single one of y'all out there that supports me, I want to thank every single one of y'all. I have so many of y'all that support me that I don't give enough credit to. So, and I just want to take the time out to give credit. Speak to y'all when can and when must, and tell y'all, what I'm going through, and tell y'all about these surgeries and the experience. So I hope you have a great day. Thank you for tuning in to my channel. Thank you for listening. Thank you for watching. Again, if you have not already, go ahead, like, share, comment, hit the smash button. Please go ahead and hit the bell at the top to turn your notifications on to get all new videos that I will be posting. Thank you, and I appreciate y'all, and I'll be back.